other new, maybe not new moms, but moms with babies. There they are.
Lauren.
These bills are about moms and babies, which is about as important an issue as we can have. And I want to thank those behind me who are behind these bills for their leadership, those in the government who will implement the legislation, and to explain the package of bills. Since it is a package, it is the omnibus. I'm going to ask the Lieutenant Governor to open it up, and then we'll go to Representative Minor Brown.
Great. Thank you. And I will open it. I got the cue, to use the mic. I don't need the outside voice inside. But Governor Carney, thank you so much for bringing us together today, and for the incredible leadership that we have here among our incredible reps and senators, and most importantly, the community. We just cannot thank you enough. When Governor Carney signs the bill, I'm sure our sponsors are going to call a few of you forward who have been advocates for 2 to 3 decades, many of you in obstetricians and gynecologists' offices, those of you working in the front lines. All I'm going to say is to Representative Minor Brown, Senator Pinckney, and to our incredible other colleagues, Senator Lockman, Senator incredible Sarah McBride, Kyle Gay, and our Representative Stephanie T. Bolden, and our commissioners and Representative Heffernan that are here, and our secretary. It takes a village in our Office of Women's Advancement. We could not do it without everyone's work. And I am going to be succinct. What I will share with you as a mom and a nurse who got her career started in the neonatal intensive care unit, and also working as a perinatal grief counselor. I spent far too many days, particularly with Black and brown women, dealing with grief and counseling, and that is a very difficult pill to swallow. And thanks to the incredible work of our Division of Public Health, our outreach workers, our members of Congress, the many incredible advocates and groups that are present, from our NAACP to the Community Outreach, Urban League, this is an important day. So I'm not going to talk long because we've got 2 incredible representatives and senators, but it does matter. Infant mortality is the #1 indicator of a community and a population's health. We have to continue to put the pedal to the metal, which we've done in this state, and in particular around equity and justice. And you're going to hear from them some remarkable bills that have been championed and worked really, really hard on by the members of our General Assembly in combination with our advocates. And with that, I am supposed to, it looks like, turn this over to the Secretary, who's going to turn it over to these remarkable members of the General Assembly, and to our Secretary McGarrick, who has long and hard worked to make sure that the health of our communities are strong, and in particular recognizes that women's health and infant health matters and is a #1 social and health determinant. And so with that, I'm going to turn that over to Secretary McGarrick. Senator Hansen, please join us up front.
Thank you so much. Thank you so much, Lieutenant Governor. And as we did a little bit earlier today, I am not going to repeat the remarks you made, but just wanted to be a part of such a historic day, because it all starts when women are pregnant people, when children are born. And if we cannot guarantee and support not just the infants, but their parents during this critical time after the birth, what are we doing? And so the work, when we talk about, and there's been so much incredible work, Dr. Carol Rattay and so many others in our department around infant mortality, we cannot forget the moms. We have to focus on maternal mortality, and so that's what this package of legislation does, and we're incredibly proud. I want to acknowledge Dr. Elizabeth Brown as well as Dara Hall, who are from our Division of Medicaid. They are doing a lot of foundational work, and we were just so proud and honored to partner and be part of the tremendous leadership that Representative Minor Brown and her colleagues are bringing to this issue that really is about equity, access, and justice. So I'm going to end there, but just again, so honored to be part of this day, and thank you to all the advocates and everyone who is giving voice to these issues, because the Lieutenant Governor again is right. It speaks to what we value in our community, where we put our money, where we put our policy, and this matters. And for far too long, we haven't done what we needed to. So again, just incredibly proud to start today and to be moving forward. So with that, again, my honor to turn it over to Representative Minor Brown.
Thank you, Secretary. Thank you, Lieutenant Governor. Governor. Good afternoon, everyone. Let me just say really quickly, if you have come to this signing and you brought your baby, please come stand with us. First, let me just start with a huge thank you. I want to thank all of you who showed up to the signing of the 2022 Delaware Momnibus. Thank you. Your support and your advocacy is the reason why we're able to get this work done. As the nation grapples with the onslaught of women's reproductive rights, Delaware, through its legislative efforts, is signing into law today significant statutes collectively enshrined in the Delaware 2022 Momnibus Act. While Delaware continues to make positive gains in the state overall for the health of women and children through the work of its key partners, such as the Delaware Perinatal Quality Collaborative, thank you, the Delaware Healthy Mother and Infant Consortium, Delaware Thrives, disparities still remain stubbornly persistent. And I have to admit, this was not easy for me. As a Black woman, as a nurse, but most importantly as a mom who has experienced preventable complications in both of my pregnancies. As an 18-year-old young adult, relying on Medicaid and state assistance, and as a 30-year-old married, registered nurse, both times I experienced preventable complications. And although I can say today that I have overcome, thoughts of those experiences continued to resurface. The trauma continued to present itself as we drafted this legislation. Delaware ranks 28th in the nation for highest prevalence of infant mortality, at 12.5 infant deaths per 1,000 live births. The Delaware Black infant mortality rate is 3 times higher than the white infant mortality rate at 4.2 infant deaths per every 1,000 live births. And since the inception of the maternal mortality review process in Delaware, Black women represent 38% of all maternal deaths. Black women represent 50% of all preventable maternal mortalities. Both mental health and substance use disorder make up 38% of those maternal deaths. In addition, there's recognition that effectively addressing women's social determinant of health needs remains the single most important factor in achieving health equity for all. And Delaware sits at the crossroad for ushering in new opportunities for better outcomes for women and children. The Momnibus puts forward comprehensive legislation in 6 key areas. House Bill 234 with Senator Marie Pinckney as my Senate Prime. This bill expands Medicaid from 6 weeks postpartum to 1 year following the birth of the baby. This bill will allow for postpartum women to have access to ongoing prenatal and postpartum care, to access to medications, mental health supports and resources, which will assist new parents in supporting their health and supporting their infant's health. House Bill 342, Senator Pinckney also as my Senate Prime sponsor, provides protections for incarcerated pregnant women by further expanding shackling restrictions to the 2nd and 3rd trimester and 13 weeks postpartum. The Delaware Department of Corrections was an early supporter and champion of this legislation, as they were for House Bill 345. Senator Pinckney again. Yes, thank you. House Bill 345 offers incarcerated pregnant women the same opportunities to access doula and midwifery care, mirroring similar standards that we have in the community. Going a step further, I'm proud to say that the Department of Corrections will also be creating a doula and midwifery program within their facility for pregnant women. And they'll also be offering this doula certification to interested incarcerated women. This is a game changer. This is going to provide women a viable skill that will serve to strengthen their successful reentry back into the community. And it also offers a positive contribution to Delaware society. Thank you. My colleague, Nnamdi Chikwocha, said once during a corrections hearing, we talk about second chances, but so many of our children have never even had a first chance. And we have to do better. These bills are the beginning to a first chance. House Bill 340, Senator Townsend is the prime sponsor in the Senate. This bill provides additional capacity to the very important work being led by the Child Death Review Commission, as well as a name change which better reflects the totality of the work under its purview. The commission will be renamed the Maternal and Child Death Review Commission to reflect its existing dual focus. The membership will become more diverse, including a midwife, one maternal and one child advocate from our statewide nonprofit organizations, and also include representation on the panel of Black, Indigenous, and other persons of color on the membership. In an effort to be transparent, this group will also be required to publicly post its draft report and accept written public comment. House Bill 344, thank you, Senator McBride, as the Senate Prime. This bill supports implicit bias and cultural competency training for Delaware's healthcare workers. This bill is not specific only to maternal health. This bill requires the development of training guidelines designed for use in all healthcare fields because bias exists in all areas of healthcare. And there's only one way to address it. The only way we're going to address it is to address it head on and to be intentional about addressing it so that we can all recognize that it exists, that it may exist within us, and we get to take accountability and ownership for how we show up and the type of care that we deliver to our patients. Then we get to recognize if bias exists, we get to check it at the door. And then we're delivering quality, holistic health care to all Delawareans. Then we can enroll Delawareans from all socioeconomic levels in trusting our healthcare system because we need to regain that trust. Then we can enroll Delawareans in managing their own healthcare, and then we will see those gaps begin to narrow. And finally, House Bill 343, thank you, Senator Pinckney, as the Senate Prime. You're just on all these bills, Senator Pinckney. This bill requires Medicaid to provide a plan for coverage of doula services. I chair the doula working group with my co-chair, Christina Andrews, under the Delaware Healthy Mom and Infant Consortium. This is an amazing group of advocates and stakeholders, and we have Medicaid Dr. Liz Brown, who's doing exemplary work, spearheading this effort in collaboration with our key partners and our community doulas. We've seen the studies, and we've seen the data, and the studies show that the use of a doula during pregnancy leads to better maternal health outcomes, leads to better infant health outcomes, and the use of a doula significantly reduces maternal mortality. As a nurse, I stand by evidence-based practice, and each one of these bills are based on evidence. One thing we know is that the data does not lie, right, Susan? The data doesn't lie, and we have an obligation to Delawareans, and especially an obligation to our most vulnerable Delawareans. Thank you, Governor Carney, Lieutenant Governor Long, our Congresswoman Lisa Blunt Rochester for the work she's doing on the Black Maternal Health Committee in Congress. To my colleagues in the House and the Senate, thank you. Public Health, thank you for the Finance Committee. We need the money. It's better to put the money in on the front end. Women's of Advancement, Public Health, DHMIC, Planned Parenthood of Delaware, Delaware Department of Corrections, Paul Shavik, Commissioner Monroe Hudson, Delaware Healthcare Association, Christiana Care, DPQC, Black Mothers Empowered, Dr. Michelle Drew, April Lyons, Delaware Now. And I know I missed so many people. There were so many people involved in this effort. And I just want to thank the moms and the babies who shared your stories and showed up today. It's all about us giving back. And to the moms and babies in the room, I just want to say thank you. And don't forget to reach back and help the next mom. Help the next mom, help her through her pregnancy, get her connected to those resources. Help her through those first stages of motherhood, because that is offering a first chance. Thank you. I'm going to now turn it over to Senator Marie Pinckney, who you've heard is the prime sponsor of many of these bills, and the bills that she's not the prime sponsor on, she's the co-sponsor on. Hey, y'all. The good thing about being the other side of the house, the other side of the sponsors, is that she did all the thanks, so I just get to say ditto to all the thank yous that she gave, because there are so many people in this room and not in this room who contributed to making all of these bills successful. As you could tell, Representative Minor Brown keeps me busy. We often jokingly refer to one another as partners in crime because we both chair corrections in our respective chambers. But today, as we've been so focused on healthcare as well as corrections, I'm thinking we should change that to partners in justice. It is an honor to be able to say that I served as co-sponsor alongside Representative Minor Brown and so many of you on these bills. The package of bills that you just heard about are the reflections of conversations that have been being had by so many of you in this room for years. It is a reflection of the advocacy that so many of you have been literally crying and screaming about for years. I'm looking around the room and I can think of so many stories that I've heard from each and every one of you about your individual experiences with maternal health care. And it's so important that we're here. It's so magnificent that we're here, because it means that the conversations that particularly Black women have been crying about, fighting for so long, have been heard and have been listened to and have been elevated by Representative Minor Brown and so many of our colleagues who push these bills along, including our finance members who made sure that we had the money to get things done. Because everybody knows in this room that without the money, it doesn't happen. Without the agencies to make sure that things get carried along across the finish line once we sign this piece of legislation today, it doesn't happen. Whenever I come to a bill signing, I always try to think about like the stories that make this real for me. And so I'm thinking about one of my, interestingly enough, she's a constituent of mine, but she was also my closest friend in grad school, as well as my biggest competition in grad school. We kept one another going, right? We would always look back and forth, like we had one of those professors that wrote all the grades on the board. And so we always knew whoever those highest two grades, they were ours. And so I'm thinking of Stephanie today, who has the most beautiful little girls, and her second little girl, I'm remembering that she told me the story about how she didn't think she was going to make it after she gave birth to her baby. She was losing so much blood, she thought she was going to die. She thought she was going to die. She thought that her children were going to be left without her, because what is happening in maternal health care is real. I'm thinking about April. I'm thinking about Tiffany and the stories that y'all tell. I'm thinking about Representative Minor Brown. I'm thinking about so many women whose stories we have heard, who are the reasons for these bills. Michelle, and the work that you do, part of the reason that these mamas make it, like so many of the advocates and so many of the stories are the reason that we're here today. And it is an honor to be able to serve alongside my good friend who keeps me busy as we get this work done together. As we sign these bills, I am going to ask that the advocates come up. I did mention quite a few when I spoke. If you could please come up and sign these bills with us, because you were at the table when we were drafting these bills. And if you are here from one of the statewide offices, please come up. Come on, don't be shy. Come on. I saw Planned Parenthood here. I saw Black Mothers in Power. I saw the Urban League. I saw Medicaid. Come on. Dappy. I think we're good.
See if I can.
I saw the coalition of 100 Black women.
Oh, I was going to say, if there was anyone else I'd be offended.
Oh my goodness. Brenda Wise, the Office of OMB.
All right, so we have a number of bills to sign, which is the aforementioned omnibus. I think it's important to note two things. One is that infant mortality as a measure of community health has been an area of focus for a long time now. And for a number of years, it was moving steadily downward, much like it was in the rest of the country. Always a persistent difference between women of color and women generally, but consistently moving downward. In recent years, it's kind of popped up and down. Representative Bolden, I'm sure, goes back as long as I do. And so these bills adding to what's been done over the years, it was mentioned by Representative Minor Brown, the various committees that were set up years ago to address this, mostly on the infant side, not so much on the maternal side. So the focus both on the infant side and importantly in these bills on the maternal side is so incredibly important. But let's be clear. There's a lot of work to do. Amen. And it's hard work. You mentioned some of the issues that are at play, and they're challenging issues. This morning we had a press conference that went to healthy Delaware communities and that overall effort. And that's kind of the comprehensive approach that we need, along with the specific tools that are granted by these bills. So I'm going to sign them one at a time. I'm going to pass them along first to you, and then you can pass it to somebody else, and by the end we'll hold them all up. So the first, I'm going to do it in order, numerical order. I was checking them off as you were going through with. It was a little off my numerical order. So first is House Bill number 234. As amended by House Amendment number 1. And so I got to do this with all these pens. Wait a minute, that's not going to work. I've got 6 of them. It's a math problem there with the pens. Okay, so there we go. That's House Bill 234 as amended by House Amendment. All right, next up is House Bill number 340 as amended by House Amendment number 1. Usually I check to see how many votes they have, but that'll take us a while. I must say this is the first omnibus bill signing that I can remember. At least a lot of time. Won't be the last. There you go.
Go nurse. Everyone's going to try to think of more. Might be the first
Omnibus.
Can't lose anything.
All right. Next up is House Bill 343 as amended by House Amendment number 1.
You're probably pulling that. My baby likes that kind of stuff.
This goes to Medicaid. All right, there we go.
No. No, maybe let's be done.
This is cultural competency training and House Substitute number 2 for House Bill number 344. Cultural competency. Right. And last but not least, House Bill number 345. No dualism in our Department of Corrections.
Yes.
There we go.
Finance.
All right, you got all those bills up? Can we hold them up? There we go. Hold them up.
Awesome.
All right, way to go.
Awesome.
Great job.